As a consultant in performance management, Danpino is quality-driven. The dedication he shows exemplifies Bluewater Health's mission, vision, and values, and the work that he produces helps Bluewater Health achieve its true potential as a performance-driven organization. Dan carries himself with poise and integrity at all times and is a respectful contributor to every team he represents. He always looks for ways to streamline work using lean techniques and improvement opportunities. The Windsor Regional Cancer Program and other LIN partners recognize Dan as a person of integrity and quality for his contributions and dedication to our team and the patients we serve. Dan exceeds expectations and can speak not only to data collected, but is able to provide an in-depth analysis for team decision-making. Our physician group depends on his data and analysis and trusts his feedback. When it comes to quality-based procedures for systematic therapy, Dan is looked to for expertise on the methodology behind it. We know that his recommendations will be solid, ethical, and patient-driven. Even though he doesn't have a clinical background, over the years he has come to understand the work of clinical staff and how it impacts data. In doing so, he has become an invaluable resource for clinical staff and physicians and a valued member of many teams. Respect, integrity, dedication to patient care, these are just some of the words used to describe Joanne Shepherd. She is a conscientious and committed nurse who treats patients and their family members with empathy and compassion to ensure they have a safe and positive experience. In the breast assessment program, Joanne often works with highly anxious patients. She treats women with the kindness, honesty, and compassion they need during a stressful time in their lives. In addition to working in CT and mammography, Joanne is also a highly competent nurse in oncology, emergency, and sexual assault. She is continuously working on learning new skills and taking on new education opportunities to further her nursing knowledge. She is highly respected for extensive knowledge and expertise and often acts as an ambassador on issues of importance. Joanne is a BPSO champion and lead for client-centered care for the organization. She is passionate about best practice and her commitment to Emily, and she brings this commitment to her daily work. She is also a member of the newly formed Interprofessional Collaborative Council, where her experience and knowledge are invaluable to the committee. Joanne is a leader in her field and an inspiration to her colleagues. Oria Teal has been part of the Bluewater Health team since 1998. She brings a cheerful and positive attitude to her work as a pharmacist and always carries out her role in the most ethical and thorough manner. Oria is an independent and motivated leader who inspires the entire pharmacy team. She's a role model, mentor, and teacher whose advice and leadership is sought out by members of the interprofessional team. It doesn't matter if it's her day off, a weekend, or she's out of the city, Oria always leaves a number where she can be reached if her help is needed. In 2012, Oria took on the leadership role for the implementation of a new system for ordering chemotherapy via computerized physician order entry. Electronic ordering is pharmacy-driven, with the pharmacy being accountable for the upkeep of the chemo regimens entered, so that the physicians can key enter in the orders rather than providing them in handwriting. Knowing that this new technology would raise the bar for patient quality and safety, she bravely took on the project. This system is the first of its kind here, and Oria's work on the project is hope for the future of computerized physician order entry at Bluewater Health.